Hi, I'm Jenny Backus, Acting Assistant Secretary for Public Affairs here at HHS, and welcome to our third web chat on health reform. We host these web chats because we understand that some of the details of the Health Reform Act can be confusing, so we're here to answer your questions. Earlier this week, we invited you all to submit your questions about health reform, and today we hope to get to as many questions as we can. We'll keep the doors open during the web chat for even more questions in case you want some clarification or want to put a follow-up. You can email us at healthreform@hhs.gov or send us a tweet on Twitter. Our handle is @HHSGOV. We'll be holding these conversations regularly in the months ahead, so if we don't get to your question today, we'll make every effort to get to it next time. Keep in mind we're also answering some of the most frequently asked questions each day on our website, healthreform.gov. That's healthreform.gov. In fact, you're watching this on it right now, so check the site regularly for more information. Joining me today to talk about the details of this law, including how it helps to increase your health security, are the two women who led the fight from HHS and the White House. Secretary of Health and Human Services, Kathleen Sebelius, and we're really honored to have Nancy Ann DeParle, Director of the White House Office on Health Reform. Okay, Nancy Ann. You are leading health reform implementation for the President and for the White House. What is the President looking for when it comes to implementation?
He wants us to work very hard to deliver the benefits to the American people as soon as possible, and that's what we're doing, working together.
That's great. And Secretary, you guys have worked together. I mean, you've been together very closely for the last year and a half. Yes. What's something about this law, and you too, Nancy Ann, that people don't know? Like, what's an unknown thing about this law that they're going to be surprised to find out?
Well, I think one of the great pieces of news for the American public is a lot happens this year. We've been talking about this law for almost a year, but here we are in 2010, and there are a lot of benefits that are about to happen. Seniors are going to get some help, small business owners, parents of kids who are about to be college graduates or aging out of a policy. So we want to make sure that people understand here in 2010 there's some good news coming their way.
Nancy, anything else you think of?
You know, I was looking at the law yesterday in particular about how it affects seniors, and I think that's one of the places where I see the biggest lack of knowledge, really. There's new prevention benefits so that tests that seniors need to help prevent disease will be covered with no copays and will be starting next year. There's coverage for doctors, more primary care doctors will get more payments, and things like that that seniors don't even know about. So we have a lot of work to do, I think, Madam Secretary, in getting the word out.
Annual checkups.
Yes.
One of the things I've always heard about, and my dad's 89 and a Medicare beneficiary, Medicare has never paid for annual checkups for seniors. And if you think about keeping people healthy, that's a great move. So starting next year, an annual checkup will be part of the overall Medicare benefit and available to everybody who's a beneficiary right now.
It's interesting that you talk about seniors, because now we're going to go to the questions that we've been getting in, and seniors are one of the people that have been getting a lot of misinformation. And it's interesting as you see the questions, they range from people repeating something they heard to asking really, really great questions. And I just want to thank you all. We've received, over the course of the last 3 webcasts, over 1,000 questions. And I'm not going to make my guests stay here for 1,000 questions, but we're going to try to get through as many as possible. And since today is tax day, I'm going to start off with a question about small businesses. And this question is coming to us from Becky in Texas. Can you please explain when employers have to declare the value of their health benefits on an employee's W-2? Does it start January 2012 for tax year 2011?
Yes, it does. So they will be doing that for the next tax year, but they won't have to make the declaration until 2012. That's right.
Now, you are overseeing it for everybody. So you're working with the Treasury Department too. They're working on this provision?
That's right. They're working together with us on our team and working with Secretary Sebelius.
And I think we also have information on the website about those benefits, both on White House, Treasury, and us. So that's a good place to go. Janet is emailing in. Different topic. You just mentioned it a little bit. Can my under 26-year-old child who is in school be covered under my health insurance policy?
Well, in the past, Janet was kind of out of luck, as my kids were. When they graduated from college, we had to go out and shop in the individual market and find plans because neither of them went into jobs that came with health benefits. That's going to change this year, so that either in a state where there's an age limit, you can't be on past 21 or 22, or until you finish full-time school, now we will have a benefit available to Janet's child and children across America that they can stay on a family policy until the age of 26. And we're defining those rules right now. We're about to get the information out to people, but it's very good news for families across this country.
And probably the young people, too.
You bet. You bet.
Donald,
they may not know it, but it's good news for them,
Their
too.
parents will tell them. Donald is following up, and either one of you can take this. What if my son graduated from college at 21 and he was dropped from my insurance plan? Now he's 23 and out of work. Can I put him on my insurance?
Yes, and as the Secretary said, she and the Secretaries of Treasury and Labor are in the process of working on the regulations that will make the guidance clear on this. So it will be sometime later this year. It's for plan years starting January 1 of next year. So it could be later this year. Some companies may come forward on their own. The Secretary's been working with them and has asked them to go ahead and keep some people on who might otherwise go off. And I actually met with some companies today who said they might reach out and allow people to come on early. But the regulations will be going out and will apply to next plan year.
Great. And just to follow up on that, when you're talking about younger people and losing jobs, Charlie from Illinois just sent this. It's a very fresh question. My girlfriend and I recently lost our jobs, and our friends told us that health insurance is now mandatory with a penalty if you do not have it. How could we afford health insurance without income, and will we be fined for not having it?
Well, first of all, Charlie, I'm sorry about the job. And unfortunately, Charlie is not alone, nor is his girlfriend. A lot of people have lost their jobs in this market and have lost their health insurance along with it, which is part of the urgency of getting this law in place. Starting in 2014, 4 years from now, when we have a new health insurance market available, there will be some individual responsibility. It always will have a waiver for people who can't afford coverage. That will always be a part of opting out. But the good news is that not only will there be an affordable market, but help for the lower income workers, some subsidies for families and workers who can't afford the 100% of the payment on their own. There'll be actually a tax break. So the largest tax break for middle-class Americans is going to be available to help people have the kind of health security that they need.
Can I just stress the 2014 date, too? Charlie's worried that he's going to get penalized tomorrow. I
Absolutely
bet
not.
Charlie will probably get a job before 2014.
Well, hopefully he'll have a job. Hopefully he'll have a job with employer coverage, because one of the things that we're trying to do is actually stabilize the employer marketplace. Make it clear that if you have coverage by your employer, if you like the plan, if you like the doc, nothing changes. In fact, we want to make it easier for small employers to offer coverage to their employees to stabilize that market. In 2014, there will be a new market for those who don't have coverage, don't have employer coverage, don't have affordable coverage in the marketplace, but some help to help pay for that.
Speaking of help, someone from Virginia, and they identify themselves as a viewer from Virginia. We are a small nonprofit organization that would like to offer our employees health care insurance, but we haven't been able to afford it. Will this new legislation help us?
It will, and I'm really so glad that it does. As the Secretary said, we want small businesses, small employers to be able to provide health insurance, and they're often the ones who have the hardest time doing it because they don't have the leverage in the marketplace to get the kinds of choices that larger employers get. So starting right now, there's a small business, small employer tax credit available, and it affects not just the for-profit companies, but also not-for-profits. So there's guidance up on the whitehouse.gov website, and as well, I believe the IRS.gov has frequently asked questions up on its website that will explain how they can take advantage of this tax credit. And we hope that will help businesses like theirs, not-for-profits, to also be able to afford to help subsidize health insurance.
Well, and Jenny, I know we've got a lot of questions, but I think this point is so important. So we've got a tax credit that starts in 2010 and is available building up to the new market. In 2014, there will be some new, more affordable options for small business owners. The kind of leverage that the big companies have or government employees have, the kind of choices that members of Congress have, because they'll be pooled with a lot of their peers. So it's a kind of step-by-step operation, but tax credits available right now. The other thing I hear all the time, and Nancy Ann I'm sure does also, is a lot of small employers say, am I going to be penalized? Do I have to provide coverage for my employees? Absolutely not. We hope that there'll be some affordable choices, that will encourage people to come into the market. But if you employ 50 people or less, that doesn't count part-time employees or seasonal employees, you do not have any mandatory coverage issues, and it certainly is not for right now. So there's, I think, a sense that some penalty is going to happen if I don't provide coverage to my employees. I think the penalty often is that you lose good employees who go down the street or around the corner because they want health benefits and you can't afford to provide them.
I'm also sort of struck by what you were just talking about. You know, the perception is it's a penalty, but it actually sounds like an incentive, right?
It is an incentive.
It's money in their pocket to help them go out and
do what
help.
they want to do anyway. At least that's what I hear. I think the Secretary and certainly the President says that over and over again. They want to provide it. It's just hard for them to find the choices and also hard for them to afford it. This will help them do that.
I don't want to hog questions with my questions, but one thing I was struck, and I want to ask you, Nancy Ann. The Secretary just sort of mentioned now to 2014. I mean, I think there's a lot of people out there that think everything this huge bill is happening to me right now. There are important things happening right now. Is this sort of designed to build to where we're getting to in 2014?
It is. In fact, we were talking about it the other day, and I think we both see it as the things that are happening now are a bridge to what happens in 2014. The exchanges, the new marketplaces that will be set up, and the tax credits that will be available for people to help them purchase. Those are the things that really come into full bloom in 2014. But between now and then, and some of the insurance market reforms, like the ban on all pre-existing condition exclusions, which we all want and wish we could have into place today, but you really can't do that until you get everyone covered. And so that will happen in 2014. But between now and then, there are things to help make the markets work better, such as some of the insurance reforms that will be rolling out this summer, the benefits beginning to close the donut hole for seniors, which is something they've needed very much for years. So those things will happen, and it will build up to the reformed marketplace that will be in full bloom in 2014.
Well, it's interesting you just mentioned markets, because Tony has a question. Tony's not with me here, but this question he's been waiting patiently with. Why are premiums still going up in large amounts, and when is it going to slow down?
Well, Tony, that's a very good question. And first of all, the new law was signed 2 weeks ago, and as we've said, will gradually be in place. I think in large part, we see these dramatic rate increases on some parts of the market. So people who are buying individual coverage, or folks who are self-employed, or small business owners who are shopping for their own plans are seeing double-digit rate increases. So two things are going to happen. A new market that will put people in bigger pools and give them some negotiating power. Some rules for the insurance companies, making sure that they have to pay the majority of money in benefits and not in overhead and CEO salaries and advertising, which they can do right now. That will be in place. But also, we're starting to take some serious steps to reduce the overall increase in health care costs, aiming at better quality at lower costs, which occurs in some parts of the system, fewer people going back in the hospital after they've been treated once, bundling care so hospitals and docs work more closely together, trying to keep people healthy in the first place and not just waiting until they're sick and paying for that care at the later point. So there are a bunch of steps that are going to happen along the way which will affect everybody, whether you have insurance or not, and lower the cost of the healthcare system.
One of the things that both of you have been talking about is high-risk pools. And this question just came in from Twitter, and it looks like it's 149 characters. How do uninsured Americans get added to the high-risk pool so they can get access to affordable insurance?
Well, that's something, again, that the Secretary and her team are working on right now. In fact, I think one of the first things you did the week the law passed was send out a letter to all the governors saying that the new law, the Affordable Care Act, does provide funding to help them and to help us provide a high-risk pool for people who have pre-existing conditions and who have been denied coverage. And so some states, maybe 20 states, I guess, provide such a pool right now, but a lot don't. And so the Secretary is going to be working with each state to figure out what works best for them, whether they want to do it themselves, as some are already doing, or whether the department will do it on behalf of the federal government, on behalf of those people in those states. So.
And there's a little bit of difference in the law between how children are treated who have pre-existing conditions and how adults. The law basically says that if you're a parent and have a sick child, that child needs to be covered starting this year, so that no policies will be written any longer that can exclude your child or the treatments he or she needs. By 2014, that's going to apply to everybody, but in the meantime, the high-risk pool for adults is available. We're starting with states, saying to states, you set up the pool, we'll help you. But it should be at the state level. But if a state decides they don't want to do it, don't want to have that benefit available to their citizens, we don't want people to be penalized by the state not willing to do it. So we will have a backup plan that individuals can take advantage of. But we hope that the governors will engage. We hope that states will indeed decide that this is a great benefit for their citizens who are right now often locked out of the insurance market.
Okay, David, I'm going to go back to something that Nancy Ann mentioned earlier. David asks, can you tell me how the new law will protect me from the donut hole? And can you explain really quickly what the donut hole is?
I will. So the donut hole is a gap in coverage for prescription drugs that seniors have. The law was changed. For many, many years, seniors in Medicare didn't have a prescription drug benefit. And the law was changed in 2003, so they now have a prescription drug benefit. But there was a gap between roughly $2,500 in spending and $4,500. There's almost a $2,000 gap where there was no assistance from Medicare. The Medicare beneficiary is on his or her own to afford those drugs. And you might imagine the people who fall into that gap, the estimates are there's more than 7 million a year who fall into that gap. Some of them get assistance from other sources like retiree coverage, but if they don't, they happen to be the people who need a drug, probably have a chronic illness and need those drugs. And we've heard many stories from people who just don't take their medications or have to make many, many other sacrifices in order to be able to afford them. So the good news is that it's being closed by the new Affordable Care Act. Starting this summer, we estimate that around 4 million seniors who fall into that gap will get a rebate check from the government of $250 to help defray some of the costs. And that's just sort of a down payment on what will happen starting in January, which is that we'll eventually close the hole over time so that over the next 10 years it will no longer be there and there won't be a donut hole. Beneficiaries will pay their 25% in the donut hole as they do all the way up to pay their piece of it, but the rest of it won't be there anymore for them.
See, that's good to know because Mary had sent in a question and she said, I don't want to seem unappreciative, but how's $250 going to help me pay for upwards of $2,800 in drugs? So what you're saying is a little bit of relief this year and working towards closing it all the way down.
So starting in January, they'll get a 50% discount on the drugs, and there's a discount on generics, which should help them. And yes, $250, we know is just a down payment on what they need, but we think it's very good news that help is on the way.
I don't think a lot of people know they're actually going to get a check, or some of them might get a check from this bill.
That's right.
And Jenny, I think one of the things that we've heard already from seniors is what do they have to do to apply?
Oh, yeah.
Nothing. This is monitored by the Medicare services. We know what people are spending on their drugs. You don't have to apply. If somebody tries to get you to sign something or sell you something related to getting this check, say no. you will be automatically mailed a check, and depending on when you actually hit the coverage gap, it could come this summer, it could come later this fall, but people do not have to apply to get it. We know the spending that's going on, and we're going to be watching very closely because the president feels strongly that this is a group of individuals who really need some help paying for their prescription drugs, and we want to make sure that those go out the door.
And that's actually, we'll get to this at the end, but we are doing next week's web chat with someone from the AARP and some of our senior folks, and we really are going to be pushing hard to educate people on that message. Nicole. Nicole has, I was wondering what the new health care bill will do for deaf or hard of hearing citizens. Are there any specific provisions? What about cochlear implants and hearing aid coverage? And we went out of the answer, so we can get back to them on that, too. I don't know the answer to that.
Well, a couple of things. First of all, I think there's some good news in preventive care. One of the things that we know, for instance, about children is that too often they might hit school and nobody's ever even identified the fact that they have some sort of hearing defect. It makes it harder to read. It makes it harder to learn. So preventive coverage expanded, I think, is the first step to even identifying some hearing issues. In terms of the overall benefit packages that will be available in the new exchanges, we haven't made those determinations yet. Those won't be available until 2014 for people who don't have coverage now, so that's coming down the road. So there are no, I would say the preventive care, the expanded health care providers is something that hits right now.
Okay. David from Washington. Does the new health care reform law include provisions for long-term care?
Yes, it does. It does. It includes a new program, a new voluntary program called the CLASS program to help people stay in the community longer. So if you decide to participate in this program and you pay in for 5 years, and you can receive a cash benefit if you have needs for activities of daily living that you just can't perform anymore. The idea is to try to help people provide for their own long-term care needs later on through payments that they will make now when they're working, they can afford it. And then if they need help later, they'll get this benefit. The estimate is it could be around $200 a day to help them with affording whether they need chore services or someone to come in and provide them some home health care, so that it would cover things that right now really aren't covered through the Medicare program or Medicaid.
Wow, that's kind of a big deal.
Probably no one's heard about that, but that's in there.
Yes.
Well, and it's, I think, as Nancy Ann said, first of all, it's totally voluntary.
Right.
No one has to participate, but it's a way that people can save some of their own salaries right now into kind of a trust fund and then get it back to use for really avoiding, in many cases, nursing home care. A lot of people find themselves in a situation where they can't fully take care of everything. You know, they can't give themselves a bath any longer, or they can't get to the grocery store, or they can't make a meal, but they really can do a lot of other things. They don't want to end up in a residential facility, but they're forced to make that choice because they're not family members around or there's not a support system. This actually helps provide some of those elements which will allow people to live independently a lot longer, to be on their own a lot longer, to have the kind of needs that they may find themselves with taken care of, and it's really their own money that they've been able to save and then draw down for these kind of services.
There's many of my friends are facing sort of the aging parents issue, and so it's just really interesting to know that that's part of this.
The seniors groups and the groups, disability groups, really advocated for this, and it's something they've sought for years because they want people to be able to prepare for that.
Okay, a family. That's all I know. They are saying, it is my understanding that all families and individuals will be required to purchase health insurance or face a fine. We talked about this a little bit. It appears that families in rural areas who do not have that many health care options are in a particularly, I've lost my next page, but they want to know how that really impacts people in rural areas where they don't have a lot of choices for doctors.
Well, you asked us at the beginning, what are the things in the bill that excite you that no one knows about? And one of the things that I think a lot of people don't know is there are policies in the law to help make sure that there are more providers in rural areas. In fact, there's bonus payments that will be available to primary care physicians who practice in rural areas, because we do know that there's sometimes, and I mean, our secretary is from Kansas and I'm from Tennessee, and we both know about areas of the country where there aren't as many health professionals as perhaps are needed. So there are provisions to make sure that they have incentives to practice in those areas. But secondly, let's be clear too that the new policy in the law that says everyone has a responsibility to have health insurance if they can afford it, and here's some help if you can't afford it, those don't go into effect until 2014. And there will be tax credits for people, families. A family of four with income of less than $88,000 will be eligible for tax credits to help them. The Medicaid program is being expanded so that people who are eligible for that will be eligible under the new law for that, if that's the right program for them. So, and there will also be an exemption. If someone just truly can't afford it, there would be a hardship exemption. So that will, we think, make it much easier for people to afford it. And then the choices they have, we think, will be much broader because of the new exchanges that will be set up so that the insurance plans will be available and accessible to people, which right now they really aren't. I think that's right. There aren't many choices in some areas of the country.
Well, we also know that a lot of docs right now who, are young students in medical school may not choose family practice or may not choose pediatric care, may not choose geriatric care because, frankly, they're not paid as well as a specialist who might be in a big city hospital. So one of the things that is being done over time is actually make sure that doctors who provide primary care, wellness care, health care actually get paid more adequately, more appropriately, and encourage more of the younger students to actually look at that specialty area, knowing we need a lot more people. If we're going to keep people healthy in the first place, we want that pipeline of medical providers. We need more nurse practitioners, and again, there is scholarships being paid off and recruitment efforts. So by the time we hit 2014, we are going to have more healthcare providers focused in this very important area.
Okay. We have about 5 minutes left, so I'm just going to try to bang through some questions here. We don't have to do speed round, but one word or less. Now, Tony wants to know, you were talking about families earlier. How is coverage of maternity care affected under health reform?
Well, it's strengthened because there are many areas of the country where insurance policies don't cover maternity care, and they will be covered under the new law. And it'll be part of the essential benefits in the new that plans need to provide. So it's strengthened.
Well, the other thing is that right now women, who are, the last time I checked, the only people who can get pregnant, are often charged far more for their health insurance than are their male coworkers or their brothers, and I think that also will change in the new marketplace. You won't be able to charge women 2 and 3 times what you can charge their male counterparts because they might get pregnant sometime.
It's not a pre-existing condition.
That's right.
Deborah from New Jersey. I'm a single mom of 2 kids. I would like to know where a person like myself stands with this new bill. In short, I have no health care for myself or my son. I've applied, she lives in New Jersey, for I guess this is a New Jersey program, New Jersey Care, but was denied. How does a low-income person like myself get health care?
Well, I can't answer specifically why she was denied, but let's just say that the bill has provisions, again, starting in 2014, where there will be a marketplace that will be available to all Americans. A hardship waiver if you really can't afford coverage, help for people who want coverage, and it will be some choices and options that people don't have right now. So right now, Deborah, your kids may be eligible for Medicaid or CHIP, and you should check that out immediately. If you have a job that provides coverage, clearly you would be available. But by 2014, there'll be a system that I think we can pretty well guarantee you're going to get some help with health insurance and have some choices you don't have right now.
And for folks who are interested in Medicaid and CHIP enrollment, we actually have a special website called Insure Kids Now.
Great.
So I'm going to ask you each for just 2 seconds of closing thoughts and then wrap this thing up.
I guess my closing thoughts are that these are great questions, and this is a great forum, an opportunity to get some of the basic information out about this new law that I think is going to be really helpful to many of these people. And I hope that Deborah goes to the website and finds out a way to get her kids covered now. But we know that help's on the way for her, and that makes me feel good.
And we are certainly going to keep doing not only these web chats, but hopefully in the not-too-distant future have some numbers that people can call. We know there are a lot of questions out there. We want to get information, and we want people particularly to know what's coming this year, what can benefit their families, their parents, their kids this year, and that information will be coming in a variety of forms, but we hope people check the website and stay tuned.
Well, great. And that just sets me up perfectly for next week. We are actually going to have a website, like I said earlier, specifically targeted towards seniors. We'll have a rep from the AARP and some of our top senior experts here at HHS. I'd say Secretary Nancy Ann will be out on the road, but we will hopefully get Nancy Ann back very soon. We want to thank you all. I know there's so many questions. We really are working with the website and with our friends at the White House to do frequently asked questions every day. So we're trying to get to your general area of question if we don't get to your specific one, but keep them coming. I hope you watch this on demand if you didn't see all of it, and I'll see you next time. Thanks.